Hi everyone, I'm Mary Jean Handy. I'm a new senior researcher at the CCPA-NS, and I'm going to be moderating today. I see we've just got one of our presenters who's just in the waiting room, and so I think once those folks are in the meeting, I think we're going to get started. Okay, so welcome everyone. So this is the launch of the CCPA-NS new report, No Nova Scotians Should Have to Work Sick, the Urgent Need for Universal and Permanent Paid Sick Leave Legislation, authored by a team of researchers at Acadia University. We're pleased to have many of the contributors here with us today and look forward to having a discussion after the presentation with some key community representatives. Before we begin, it's important for us to acknowledge that in Nova Scotia, we occupy the unceded and unsurrendered ancestral territory of the Mi'kmaq people. I'm also currently joining this webinar from Toronto, the unceded and ancestral land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. The report, No Nova Scotians Should Have to Work Sick, was released earlier this summer on July 28th, which was just days before the Nova Scotia COVID paid sick leave program expired on July 31st. And the report details the need for paid sick leave in Nova Scotia and underlines that for sick leave to be effective, it must be universal, paid, adequate, permanent, accessible, and employer provided. So after the presentation from the report's authors and comments from 3 community representatives, there'll be some time for questions and answers. At the time of the Q&A, we ask that you type your questions in the chat box. And Lauren and I will be watching the chat box, and we'll keep track of the questions as they come in and read them out. If you're having problems with the sound or with the presentations, you can just raise your hand, or you can flag your questions or concerns in the chat box, and we'll try to attend to whatever technical issues we might be having. We have a bit of a tight program, so I want to get started right away. And to begin, I'm going to welcome Dr. Rebecca Casey and Dr. Rachel Brickner, co-authors of the report. They're going to be presenting. Dr. Casey is an assistant professor in the Department of Sociology at Acadia University in Wolfville, Nova Scotia. She is a research associate with the CCPA-NS and is the author of another CCPA-NS report in 2019 called A Rising Tide to Lift All Boats, Recommendations for Advances to Nova Scotia's Labour Standards Code. Rebecca is also the author of Closing the Enforcement Gap, Improving Employment Standards Protections for People in Precarious Jobs, which was published by University of Toronto Press in 2020. Welcome, Rebecca. And Dr. Brickner is a professor of politics at Acadia University. Her ongoing research explores the politics of public education in the United States and Canada through the lens of a feminist ethic of care. She is working on projects exploring the policy implications of the COVID-19 pandemic on workers in Nova Scotia. Rachel is also a research associate with the CCPA-NS. Welcome. So with that, I will invite you to share your presentation, and looking forward to hearing the presentation. Thank you.
Thank you. Thanks for joining us today to learn more about our CCPA Nova Scotia report on paid sick leave. In this slide, we're showing the current state of sick leave policies before we talk about the emergency leave policies that were created in response to the COVID-19 pandemic. There's 3 jurisdictions, federal, Quebec, and Prince Edward Island, that include paid sick days for workers. Federal workers are guaranteed 3 paid sick days and 2 unpaid sick days under the Canada Labour Code, while workers in Quebec have access to 2 paid sick days after 3 months of employment with their employer. And workers in Prince Edward Island who have worked for 5 continuous years with the same employer have access to 1 paid sick day and 3 unpaid days. Nova Scotia is among the worst in Canada. Workers are entitled to 3 days of unpaid sick day per year. However, there is no eligibility requirement for workers in Nova Scotia, which is beneficial for the workers. Whereas in other jurisdictions, workers may have to work for the same employer for 3 months before they have access to an unpaid sick day. We use Statistics Canada to 2016 General Social Survey, Cycle 30, which studies the Canadians at work and home, to examine which workers have access to paid sick leave. It's just important to note here that we don't know how many days they had for their paid sick leave, rather they just had access to at least 1 paid day. Others may have had access to more. But in most cases in our report, we are able to compare access to paid sick leave in Nova Scotia to what is happening for all workers in Canada. So even though employers are not required to provide paid sick leave to their workers in Nova Scotia, it's not part of the Labour Code, you can see here that 42% of workers in Canada have paid sick leave. And in Nova Scotia, workers fare a little bit better as 46% have paid sick leave. But this means that 54% do not have access to paid sick leave. Access to paid sick leave is the best in Newfoundland and Labrador, as you can see here in this graph, and the worst in New Brunswick and British Columbia. So using the General Social Survey, we examined some of the highlights from our report by showing which workers do not have access to paid sick leave. Just to remind you, as we mentioned earlier, 54% of workers in Nova Scotia do not have access to paid sick leave. Workers who are in non-permanent jobs, such as seasonal, term positions, casual jobs, or on call, are the most vulnerable, as 72% of these workers do not have paid sick leave. Now, in comparison, 51% of workers in permanent jobs do not have access to paid sick leave. Being a member of a union can provide extra workplace protections, and access to paid sick leave is one of them. 62% of non-unionized workers in Nova Scotia do not have access to paid sick leave. In comparison, 36% of unionized workers do not have access to paid sick leave. Low-wage workers are also less likely to have access to paid sick days. Among those earning less than $25,000 a year, 69% do not have access to paid sick leave, compared to 39% of those earning $100,000 or more a year. Workers who are both low wage and in temporary positions are especially vulnerable. Small firms in Nova Scotia do a better job providing paid sick leave to their employees compared to small firms in Canada more broadly. While 58% of employees in small firms in Nova Scotia do not have access to paid sick leave, 68% of Canadian employees in small firms do not have access to paid sick leave. So it's better coverage in Nova Scotia. However, employees in large firms have a similar coverage to employees in small firms. So for example, in Nova Scotia, 59% of workers in large firms with 500 or more employees do not have access to paid sick leave. A mandatory paid sick leave policy will ensure that all workers have access to paid sick leave regardless of where they work. Our report also highlights some of the worker characteristics where access to paid sick leave is not available. So 75% of young workers, 65% of single workers, and what we mean here is workers who are not married or in a common law relationship or had been previously married, and 58% of workers with high school education or less do not have access to paid sick leave. So now I'm going to pass the presentation over to Rachel.
Thanks, Becky. So I want to highlight some other data from the report that draws on a couple different data sources from the Statistics Canada GSS data that Becky was just talking about. And the first data that I want to highlight from our report comes from a study that Becky and my team at Acadia University did in the first wave of the pandemic. What we did was a survey of 3 groups of essential workers, and these were teachers, long-term care workers, and retail workers in Nova Scotia. And we surveyed each group separately with questions about how COVID during the first wave impacted their health and well-being at work. So Becky, if you can move the slide. So what I want to do, or what we want to do here, is highlight a little bit of the data on paid sick leave, because we did actually ask some questions about access to paid sick leave before the pandemic started. In terms of access to paid sick leave before the pandemic, teachers who participated in our study reported that 98% of them had access to paid sick leave. Long-term care workers reported that 90% of long-term care workers reported that they had access to paid sick leave. So those are both pretty high levels. And in terms of the retail workers who participated in our study, only 42% indicated that they had access to paid sick leave prior to the pandemic. And I'm going to come back to the retail workers in a minute. But we also asked an interesting question, which was, regardless of whether or not you had access to paid sick leave, did you feel expected to go to work when you were sick? And 65% of teachers said yes, they felt expected to work when they were sick, compared to 54% of long-term care workers and 53% of retail workers. And this is a really interesting finding. Unfortunately, we didn't ask any further questions about why they had that expectation. So it's a really interesting avenue for some future research to really dig into, why do people who have access to leave actually feel inclined to work when they're sick? And why do people feel inclined to work when they're sick in general? So going back to the data on retail workers, 58% of the retail workers who participated in our study did not have access to paid sick leave. And of those, 41% who did not have access to paid sick leave did go to work when they were sick prior to the pandemic. And of those 41%, 88% reported working when sick because they needed the money. So in this group of workers, the 88% of retail workers who reported going to, of the 41% who went without paid leave, who went to work sick, 88% of those said they felt this tension between their financial well-being and their physical well-being. And so we see the importance of this paid sick leave policy playing out in this particular group of people. Can you go to the next slide, Becky? Thanks. Another source of data that we drew on for this report was the jurisdictional legislation about temporary paid sick leave policies. One of the things we wanted to do was to show, okay, COVID created this moment where we saw the real importance of public health in its relationship to workplace health. And so we wanted to show what jurisdictions throughout Canada did specifically during COVID with respect to paid sick leave. And what you see, I'm not going to go through this chart in a lot of detail, but what you see is that there are 6 different jurisdictions, including the federal government, that provided some level of paid sick leave. And other than the federal government's paid sick leave policy, most of the provincial and territorial governments implemented their paid sick leave policy during the third wave. And that is true of Nova Scotia as well. As you can see, Nova Scotia's paid sick leave policy was implemented for the fairly short period of May 10th through July 31st. And what it did that was great was provide paid sick leave for workers who were either self-employed or who didn't have access to paid sick leave through their place of employment. who couldn't work remotely and who weren't able to work more than 50% of their shift. So it provided some pretty broad coverage for people who really needed it because they didn't have access to it and couldn't work remotely. But as I said, it was a temporary solution and only provided 4 paid sick days. So not even enough to isolate and to follow public health guidelines if in the case of the need to isolate. So what I'll just do to wrap up our presentation is to, Becky, can you go forward? Thanks. I just wanted to wrap up our presentation by reminding, oops, sorry, that's my timer, reminding people of the 6 principles that we advocate for in our report. And Lauren briefly, or sorry, Mary briefly announced these earlier in the presentation. So first of all, this should be a universal policy. It should be available to all, regardless of the status or characteristics of the employer, or sorry, of the employee. It should be paid to avoid that fundamental tension between having to go to work sick because you need the money and staying at home and trying to improve your health. It should be adequate. It should be what we're advocating for along the lines of other advocacy groups, as well as the federal government, which has proposed changes to its federal labor code, is 10 paid sick days, which would provide enough time if workers needed them to recover from a cold or flu, to get access to preventative care if necessary, to care for a sick family member as well. It should be permanent, that is to say, included in the Labor Standards Code and not with an expiration date. The previous plan is great, except it's no longer with us. And it should be accessible. We need to try to eliminate burdens such as requiring a doctor's note so that paid sick leave can actually be meaningfully a benefit for workers. And then finally, it should be employer provided. We know how important it is for employers to have workers who are able to go to work and be well enough to actually do their jobs productively instead of simply being present. And so since there is this benefit to employers, there is some obligation of employers to cover the costs as well. And that's all from us. So we look forward to your questions about our data and our what we're asking, what we think is important in a new policy.
Thank you so much. So now that we've had a presentation from the authors on the report, we're going to welcome some community representatives. The first is Danny Kavanagh, president of the Nova Scotia Federation of Labour. Danny has a long history in the trade union movement, serving in many roles in his own union. I'm hearing a bit of an echo. So is that from you, Danny?
Hi, can you hear me all right?
Yeah, I can hear you all right.
Okay.
So Danny has a long history of in the trade union movement, serving in many roles in his own union, CUPE Local 734. Danny believes it's Labour's role to be an active participant in the political process, to advocate and push governments to do more to help working families. Welcome, Danny.
Oh, thanks so much. And thanks everybody for taking some time out of your lunchtime today to have a discussion about paid sick days. Maybe I'll just start off by saying that the Federation of Labour will be reconvening its campaign now that the new government has been sworn in about sick leave. Of course, we have new ministers, new government in place. There's been some changes made, so our campaigns will be reconfigured that people can just go to our website and follow along. We'll have, in particular, 2 campaigns out of some that we have going. One's around asking for paid sick leave, and the other one is about changes to labour standards in Nova Scotia. And I think part of what the report points out here is that labour standards in Nova Scotia have not been updated in their entirety since about 1972. So 40 years. There's been no complete modernization of labor standards in Nova Scotia. They're very inadequate, they're outdated, they need to be modernized. You know, there's been piecemeal parts of it that have been changed by government, you know, over a period of time. But nonetheless, you know, operating in 2021 under labor standards that are, you know, essentially 40 years old, speaks for itself, I guess. I don't, you know, in Nova Scotia, in fact, that we do have the inadequate paid sick leave program, I think is very important. Again, in you know, in the climate that we're in, coming out of the pandemic, has really shown the need that we must have, and we need to have paid sick leave program. I do work with the other federations right across the country, and we've raised this in each of the different provinces as well, around the necessity of paid sick leave. And of course, we work with the Canadian Labour Congress, who is also, you know, joined the campaign calling for paid sick days. You know, it's really amazing then when you think about that only 54% of Nova Scotia workers had access to paid sick leave through their employer. You know, that's really not very good this day and age. And, you know, some of the numbers that were pointed out by the report authors around, you know, the 88% of retail workers who don't have access to paid sick leave is really scary. And, you know, people having to go to work when they're sick. I mean, we can all just picture, you know, who wants to go into a restaurant as an example where you have somebody that's waiting on your table that's sick, or the cook in the kitchen is sick, or, you know, they'll pass those, you know, that sickness along. Part of what the report outlines a little bit on, it doesn't touch on it completely, of course, but is around the need for sick notes as well, which are a complete waste of time. And, you know, I hopefully with the Houston government coming in, and it's some of the quick changes they can make around healthcare would be one to abolish the need for sick notes. So it's a really important issue. You know, we hear that from doctors all the time. People that are going to work sick is just really not necessary. It shouldn't be happening this day and age. We lag behind many other countries around having this benefit. Workers deserve to stay home if they're sick. We need to, you know, keep them from becoming more sick. And we need to protect the co-workers. It'll actually help save lost time and productivity. So kudos to the authors for the report. It's an excellent report, and now it's going to be up to all of us to push the current government into making sure that we get paid sick days in Nova Scotia. And that needs to be those permanent 10 paid sick days, which everybody can access. There needs to be no barriers put in place for workers to be able to access that sick time. So thanks for the report, and I'll turn it over to you again.
Thank you. So now we're going to welcome our next speaker, Lisa Cameron. Lisa is a labor activist, union organizer, and organizing member of the Halifax Workers Action Centre, a joint project between Solidarity Halifax and the Halifax, Dartmouth and District Labour Council. The Workers Action Centre provides education and information to enable workers to organize for positive change. Welcome, Lisa.
Thanks so much for having me. Yeah, so much wonderful research went into this report, which supports a common sense approach to the prevention of illness spread. I want to remind everyone that at the onset of the pandemic, Stephen McNeill so famously ordered Nova Scotians to stay the blazes home, despite the fact that so many in the province lacked the ability to do so. For example, back in September, the Halifax Workers Action Centre received a call from an individual who was fired from her restaurant job for taking the 2 weeks required to quarantine. This worker had informed her boss before leaving the province that upon her return, she would need to quarantine in accordance with Nova Scotia's COVID restrictions. The employer granted her vacation time, but later informed her that they would not be able to accommodate her unpaid and mandated absence from work, and she was removed from the schedule. So this is just one example of a worker who, without paid sick leave, was retaliated against for doing her part to keep her coworkers and the public safe. We know that workers without paid sick days are more likely to be in low wage, often public-facing service jobs where the risk of infection is especially high. This was true before COVID, during COVID, and will remain the case. We also know that these jobs are disproportionately held by women, racialized workers, and workers with disabilities, making the issue of paid sick days a racial, gender, disability, and economic justice issue as well. I wanted to quickly explain that precarious and low-wage workers are most dependent on improvements to legislation, and this is because their employment contracts rarely exceed the protections set out by the basic employment standards. And this is one of the reasons why legislation is so important in supporting those who are most vulnerable. Currently, under the code, Nova Scotians are only entitled to 3 unpaid sick days. 54% though of Nova Scotia's working population lack paid sick days, and many of these individuals do not earn enough to comfortably forfeit wages in exchange for needed time off. In response to public pressure, the province of Nova Scotia offered paid sick leave to account for gaps in the federal CRSV program. However, this only took effect over a year into the pandemic and only provided eligible workers with, as has been said, 4 paid sick days, and only spanned from May 10th to the end of July, even though COVID remains a persistent threat. Further, there were several administrative obstacles and strict eligibility criteria, as well as short timelines, which made it difficult for many trying to access the benefit. But what the Nova Scotia program, I think, taught us some important lessons. First, that public pressure on provincial government works. The louder the calls to action get, and the more united we stand on issues like the need for paid sick days, the more responsive our government will be. So our voices do matter. And secondly, it taught us that government paid sick days come with challenges that likely wouldn't exist if the paid sick days were employer provided. Requiring bosses to cover the cost of paid sick days would help reduce delays in pay, like we saw with the provincial government, would unburden the taxpayer, and would make it easier for workers to address instances of non-compliance. We also know that employer paid sick days come with enormous benefit to bosses, so why should the public front this cost for them? So for this reason and others, the Fight for 15 and Fairness campaign, which has been a leader in the fight for paid sick days in Nova Scotia and beyond, and the Halifax Workers Action Centre, and many others are demanding 10 permanent employer paid sick days. I'm also going to echo what other people have said, that we're also demanding restrictions on an employer's ability to request medical documentation of workers experiencing short-term illnesses. When a worker has to provide their employer with a medical note, they are forced out of their homes and into public spaces like hospitals and medical clinics, where the risk of infection is especially high. And this is all just to satisfy an employer's administrative need, which not only burdens the unwell worker, but also the medical system at large. This, again, is something that's problematic during a pandemic, but has always been a problem and will continue to be if certain restrictions are not legislated. So again, I want to thank the CCPA report for the excellent research that they've conducted, which supports and validates the demands of the Halifax Workers Action Centre, which we believe will create a better, safer future for workers. Thank you.
Thanks so much, Lisa. And so finally, I want to give a warm welcome to Stacey Gomez. Stacey is an organizer with Known as Illegal Halifax, Kjipuktuk's Migrant Workers Program, and is a member of the Nova Scotia Migrants Worker Rights Working Group. Welcome, Stacey.
Thank you. Thanks for having us. Known as Legal Halifax's Migrant Workers Program works with Jamaican and Mexican, as well as workers from other countries in the agriculture and seafood processing sector throughout Nova Scotia. And so migrant workers are tied to one employer. They're on closed work permits, and they have temporary immigration status in the country. There are workers who've been coming to Canada for 10, 20, and even 30 years. And through this program, they do not have access to permanent residence. They don't have a pathway to permanent residence. So these are factors that make workers specifically vulnerable. They're particularly vulnerable to employer abuse, and also there are particular impacts on their health. So we saw that throughout the country, there were migrant workers being disproportionately impacted by COVID-19. Recently, over 100 migrant workers shared their priorities for change with us in terms of what should change at the provincial level. And a key issue that was raised was the urgent need for paid sick days. So migrant workers, like everyone else, get sick sometimes, but they rarely get paid sick days. So I want to share with you two quotes from two workers about the importance of paid sick days. So the first is from a Mexican farm worker in Nova Scotia. He says, "Definitely paid sick days are important. We are the sustenance of our families. Just because we are sick doesn't mean that they stop having needs. We are farm workers, not work machines. Well, even on some occasions, machines break down." And the other is from a Jamaican farm worker in Nova Scotia. And she says, "I have been coming to Nova Scotia for 6 years, and I stay here for 6 to 7 months at a time. I work on a strawberry farm on my knees, day in and day out. I leave my son in Jamaica to come here and work so I can send him to school and feed us. This year, when I got my second COVID shot, I was very sick. I couldn't stand. I had pain all over my body, fever, and a terrible headache. We work for minimum wage and every dollar counts, but our work is very hard on our bodies. We work on our knees, and when it's busy, the days can be up to 11 hours long in the hot sun. The way I was feeling, I knew I couldn't manage the work. I ended up missing a day and a half and lost pay. There have been times when I felt unwell, but I forced myself to work because I needed the money to support my son. And also because if our supervisor thinks we're too weak, or if we get sick too much, they may send us home and not ask us to come back the next year. We live in fear of that all the time. They often tell us that they can send us home and 100 people will jump to take our place. There is a lot of pressure on us to work hard and fast. I think we deserve to have some paid sick days. We work hard to grow food for people from here, but no kindness or benefits ever flow to us. Sometimes I feel like we're just machines to these people, or even donkeys. We just want to be treated like humans. Many people can't speak like this and say what I'm saying now because they're afraid they'll lose their job. I was afraid to speak too, for that reason. We can really only be free to push for our rights if we have permanent residency here. This is our reality. So some of the key themes that also came up in conversations with migrant workers about paid sick days is that migrant workers, as was mentioned in this quote, are made to work in all conditions, in the heat, in the rain, and in the snow sometimes. They also work long hours, 6 days a week, and sometimes 7 days a week. And these conditions contribute to migrant workers getting sick, in addition to other workplace-related hazards. And many make the sacrifice to come here so that they can take care of their families back in their home countries. And if they get sick and take a day off, then they're not able to meet that responsibility. If they get sick, injured on the job, or they risk being fired, sent back to their home country, and then barred from the program. So that would have a significant impact on them and their families. And sometimes they are forced to work even when they are sick by their employers. So for these reasons, migrant workers are joining the call for 10 paid sick days a year. And this must be coupled with full and permanent immigration status for all so that they can truly exercise the same rights as all workers in Nova Scotia. And this is clearly also an issue of racial equity. So we continue to highlight that migrant workers are important members of our communities, and it's crucial that migrant justice is part of these conversations. Thank you.